Hey, listener, welcome to Vetsplanation, the podcast that helps explain to you, the pet parent, how to keep your pet happy, healthy, and safe. I am your host, Dr. Sugarman, and did you know that there's research being performed that is specifically for cats? They have turned a fatal disease into a curable one and are working on more ways to help extend our cats' lives every day. Today, we're going to be talking to the crazy cat vet, who is one of the researchers and one of our heroes trying to help do just that. Real quick, if you do like what we do, please make sure that you subscribe and give us a 5-star rating. Let's jump into our interview now. Hello, everybody. Welcome back to Vetsplanation. I am your emergency veterinarian and host, Dr. Sugarman. I'm so excited today. So we have our third episode in our FIP Chronicles here, and we're going to be talking to Dr. Cerna today. She has been amazing, just so amazing helping our cats who have FIP. So thank you so much for coming on, Dr. Cerna.
Thank you so much for inviting me. It's always a pleasure to talk about cats for me.
You do love cats. I have learned that about you so far. Yeah. So
But
can you?
6 at home.
Yeah. Oh my gosh, that's a lot of cats. Yeah.
You could probably call me a crazy cat lady.
Yeah. So tell me about your background.
Yeah, so I actually originally come from Czech Republic, which is a small country in Central Europe, and have always been in love with cats most of my childhood, despite my parents really trying hard for me to find a different
Mhm.
profession. So I actually have a law degree because
Oh my
I
gosh, how
they were
funny.
really against me going to becoming a vet. So
Yeah.
I went and got myself a bachelor from law, and then I, behind everybody's back at home, applied to vet school, which somehow I don't know how still I got in.
It's amazing all the different backgrounds that people have.
Yeah,
Yeah.
I know. And then I think my parents, from when I was about 14, and I started being like very crazy about cats and breeding cats and going to cat shows every weekend. I think when I then
Yeah.
told them I'm quitting law school, or I actually didn't quit, I got my degree and then I got my master's on distant studies too. But I think they realized that there was like no way I was ever like not gonna be a vet.
Yeah, yeah. You're like, I did this for you guys, and now I'm gonna go do what I want to go do. Yeah.
Exactly. But I actually went to vet school because I wanted to be a feline vet or a cat vet, because I thought
Nice.
I was just like paying all this money to my vet for those vaccines and space of my kittens. And I just thought I could do it cheaper myself, which obviously proved very wrong, seeing how
Yep.
much my friends from law school make now
Exactly.
and how much I make. So definitely
Right.
very wrong there. Yeah, but I absolutely love my job. I would not change it for a second. And I am so glad I proved most of my teachers in vet school wrong, because they kept telling me I cannot be a cat vet.
Yeah, everybody's like, oh no. I have a friend in vet school. She was like, I'm just gonna do puppies and kittens. We're all like, you cannot do that. But she is an emergency vet now. Just saying, but still.
There are a lot of kittens and puppies in the
Yes,
ER. Yeah.
exactly.
I went last year with my kitten when she was lame, and I was sure we have a broken bone, but
No.
it was just a like a pulled muscle or
Oh,
something.
good,
So
good.
yeah. Yeah, but yeah, so that's how I started with vet school. And then I left to Scotland and spent 2 years in Scotland after my
Wow.
vet school, where I did my rotating and then my specialty internal medicine internship with actually very famous Professor Gunn Moore. She is and probably the ultimate level of a feline
Yeah.
veterinarian. And she was my mentor, and I think I owe her probably everything I have now with my career. So she's
Oh, that's amazing.
yeah.
Very cool.
Yeah.
And then how did you get into research then?
Yeah, so I actually came to Colorado and met Dr. Lapin, my other amazing mentor here
Nice.
at CSU, who was a friend of Professor Gunmore. And when I came, I was supposed to just do my 3-year internal medicine residency at Colorado State University. But he knew back from UK because he heard some stories about me. And so he knew I was very much into research, because
Yeah.
I think with the research, and I love doing clinics and helping cats on clinics, but with research, I think the impact that I have on so many more cats in
Mhm.
that I can help is just what has fascinated me about veterinary medicine, and how much I can change lives of so many cats. Because even though, for example, now I'm doing this clinical trial where we have 61 cats, which you would think it's a lot of cats, but I
Yeah,
really believe we are actually going to save hundreds, if not thousands, of
exactly.
cats, showing people what these drugs can do.
Absolutely. Yeah, that's amazing. Yeah, you're right. You are helping so many more cats. It's we can, as me as an individual doing ER, I can only help the cats that I'm seeing, but you're helping all the cats that you can't even see. Yeah.
Yeah, and that's probably what I love about research.
Well, can you tell me a little bit about research in general? Like, what does it involve?
Yeah, I think that's a great question because I think if I tell somebody, oh, I'm doing all this research, I think people always imagine I'm doing all these crazy experiments or
Right?
something like that.
Exactly.
But there are actually a lot of
Uh,
roles behind doing research.
mhm.
So you cannot just wake up one day and say, oh my God, I'm gonna go and give all these drugs to these cats and see what happens. So we actually usually start with healthy cat research. So sometimes we have to see, or even before then, most of the times we would start with some in vitro work. What it means is that we take, for example, these cells in laboratory and we infect them with feline coronavirus, for example,
Mhm.
and then try to protect them from the coronavirus with these drugs that we would use in cats. So I actually started
Wow.
with this clinical trial that we are doing now. We actually started doing some bench work or laboratory work a couple years ago
Wow.
to get where we are. So it's
Mhm.
definitely not a short process. It usually takes years if you want
Yeah.
to do research right. So we started when I came to Colorado in about 2021. I came 2020, but it was COVID the first year. Things were not great. So
Yeah.
after that, after that, we started focusing on some lab research and then moved into doing some healthy cat research and making sure the drugs we want to use are safe to use in cats. And it got us to 3.5 years later into
Wow.
starting a clinical trial for feline infectious peritonitis.
Yeah, it is amazing. I don't think people realize like how early you have to start this and how long that process is to be able to do all of that research.
Absolutely. Plus, there is all this paperwork because
Mhm.
there are review boards that actually look at the study design I've designed and what I want to do. And they, of course, comment a lot on it because we want to, one, make the study a success,
Mhm.
but also make sure that the clients and the patients that come through the hospital, of course, that are safe and we have done everything as safely as
Mhm.
possible for them.
And if I remember, the committee has not only like people who are veterinarians on it, it also has layman people as well who have no animal experience. Is that right? Well,
Absolutely.
veterinary experience at least. Yeah.
Yeah, absolutely. So we have a lot of people on the board who are researchers from
Mhm.
different fields. So, for example, immunologists, biologists, virologists who are on the board as well, who are not veterinarians. And I think this is important because it is easier, I think, to explain the study to someone who has medical background. But a
Mhm.
lot of my clients, they are not vets, right?
Right.
So they
Exactly.
cannot. We need to make sure all the consent forms, all the paperwork, and everything is written and explained in a simpler way so even someone without medical background can understand
Mhm.
what their pet would be going through.
Absolutely. Great. I've actually already gone a bit in depth on FIP, but can you just give me like a short synopsis on what FIP is?
Absolutely. So FIP, it's a viral disease in cats. It's caused by feline coronavirus. So it's actually a little bit similar to the human coronavirus. They are not completely the same, but a little bit similar to the human coronavirus as well. And it's an RNA virus, same like human coronavirus. And what that means is that we can actually use some of these human drugs from COVID for feline infectious peritonitis. And the prevalence of feline coronaviruses is actually very high. About 90% of cats would be infected with coronavirus,
Mm.
especially in multi-cat households. I always say I would bet you $100 that all my 6 cats are actually having
Yeah.
coronavirus.
Probably, and even the stray cats that we think about, yeah, I'm sure that's
Absolutely.
a high number, yeah.
Absolutely. It's just so sad. And most of these cats just never develop any clinical signs. But about 5 to 10% of these cats, unfortunately, have this other form of the virus, which is called the feline infectious peritonitis virus. And in these cats, instead of it just being in their gastrointestinal tract, it goes and moves into their organs like liver, spleen, in their eyes or neurological tissue. And these cats then become very sick and this disease used to have 100% mortality.
Yeah.
So almost all cats would die within 1 month of being diagnosed.
I feel like that's even such a high number being 1 month. I feel like most of mine died within days to weeks.
Yeah,
Yeah.
it is very sad disease,
Yeah.
and I have actually lost a lot of my own cats to FIP when I
Oh,
was a cat breeder,
yeah.
and that's kind of what it got me very passionate about wanting to do more research on this disease.
So what does your research involve? Like, what exactly are you researching?
Absolutely. So right now I am actually researching a lot of things, but right now my main thing is we are doing a clinical trial with a new drug called molnupiravir, which is an antiviral drug for patients with COVID. And we are giving it to cats who have what we call naturally been infected. So we are not infecting any cats with FIP. These are
Mhm.
all cats that have become sick in their homes. And we are treating them twice a day with this antiviral medication. And on top of it, actually, we are testing a new immune stimulant as well. So half of the cats, on top of the antiviral, received an immune stimulant, and half of those cats received placebo,
Okay.
because we want to see if the immune stimulant together with the antiviral will give us a better chance of a success for treatment, but also help us decrease the relapses for the disease.
Wow. Okay. And so how exactly do those medications work then?
Yeah, absolutely. So the antiviral medication, actually, with the one that we use is molnupiravir, it actually induces mutations to the virus to make the virus become lethal to itself.
Hmm.
So it's actually very,
Wow. That's really cool.
it's a very, very, very
Yeah.
smart drug. It tries
Yeah.
to outsmart the virus.
Right.
Yeah. And the immune stimulant actually works on different pathways to try to help these cats stimulate their immune system to fight the disease. Because we have a lot of studies from the past, and we know that the cats with FIP usually have some immune system dysregulation and they are unable to fight the disease. So that's why in these cats, we are hoping when we treat them with the antiviral and immune stimulant, we will get better outcomes.
Mm, okay. And how's this been going so far? Because have you seen really good results from it?
Yeah, actually,
Yeah.
I'm very excited. So we
Good.
definitely have been seeing a very good success. So I think of course, do not have the full statistics
Right?
and data to share, but I think we're around about 80% success. So
Wow.
from 100% lethal to about 80% chance of survival. So that is really, really good so
That's
far.
amazing.
Yeah, we have still a lot of patients enrolled in the current clinical trial and still not having finished yet the full therapy. So I cannot comment on the relapses, but
Mhm.
from the cats that have relapsed so far, it is under about 10 to 15%. So
Wow.
we are excited about that too. But
That's
these are
great.
very preliminary data, and we still have about 40 more patients to finish the
Yeah.
study. A lot of them are finishing actually this month, which is very
Oh, yay.
exciting. I just had
Nice.
one finish today, which it's always very sad because we've been seeing them from very sick cats to
Yeah.
becoming big and healthy cats, and we get
Right.
used to the owners and of
Mhm.
course the patients. But I always tell them, I hope I'll see you never again.
Right? Exactly. I feel like most people say the same thing to me. I'm like, "Yeah, I'm the overnight vet. Nobody ever wants to see me again." So I
Yeah.
get it. Yeah. So tell me, what does this mean for our FIP kitties? I know one big problem is that these drugs are not FDA approved yet. So what does this mean now?
Yeah, absolutely. So it is unfortunate that a lot of these drugs are actually not FDA approved in the United States, because
Mm.
Australia and United Kingdom actually have such a huge variability in what they can
Yeah.
treat these kitties with.
Yeah.
So I'm quite hopeful that the molnupiravir can one day get a full FDA approval for humans, and then we could be prescribing an off-label for our cats.
Yeah.
And there is actually another drug on the market right now that has full FDA approval now for COVID patients. And I think that's probably something we're going to be doing a next clinical trial on as well. We
Nice.
are just finishing some, again, in vitro, so the lab
Mhm.
work for toxicities and everything. And I'm collaborating with other researchers from all over the country, but also abroad. And I'm hopeful that we might actually have a new drug that is already FDA approved for humans, and we are hoping to do some clinical trials with that later this year.
That's amazing. So will you be opening that up to like people in the households again? So not what did you call it? Naturally infected
Yeah.
patients again?
Yeah, absolutely.
Nice.
So once we get everything to a point where we think it is safe to start treating some kids with feline infectious peritonitis, then we'll definitely be opening a new clinical trial for them.
Nice.
I am also hoping to do another trial where now we have been treating patients for 12 weeks of therapy, but we actually are seeing huge improvements by week 8.
Mhm.
And we've had multiple patients where we had to remove some of the fluid they accumulate in their chest because of their respiratory distress, or they struggle to breathe. So we have removed fluid after just a couple of days of starting the therapy, and we actually cannot find the virus anywhere
Wow.
anymore after just about 3 to 4 days of the antiviral therapy. So I actually don't think that we need to really treat these cats for 12 weeks.
Mhm.
So my next, I think, step is going to be trying to see if we can shorten the therapy maybe to 8 weeks,
Yeah.
because most of them in 8 weeks have no laboratory abnormalities. So their blood work is normal. They don't show any clinical signs. But I just need all these first study patients to
Right.
finish so we can do all the analysis. I
Right.
don't My boss always says I'm like 2 steps ahead, and I love being ahead because now it breaks my heart that I have to say no to patients
Right.
instead of enrolling them in the study.
Mhm.
But unfortunately, sometimes it is what it is because we also don't have unlimited funds
Right.
for these studies.
Hmm.
So that's another challenging part.
Yeah, you had mentioned the funds real quick. So how do you get funding for this research?
Yeah, that's very great question. So, I wish sometimes I was doing human medicine, but only when it
Right.
comes to grant applications, because in human medicine you can get hundreds to millions of dollars for
Mhm.
studies. We are usually looking at 35 to $50,000 if we are lucky when we are
Yeah.
applying for grants from agencies. So that's why we are quite limited in how many patients we can treat.
And is
Uh,
that the study like the whole thing from embryos to where we are now? Like,
No, this would be just usually the cost of these studies are much, much higher, of course.
okay.
So
Yeah.
we get some private donations, but especially this clinical trial has been funded by the Every Cat Foundation, which
Nice.
is a very, very wonderful foundation that supports mainly or only feline research,
Mhm.
actually. And particularly, they have a special fund for feline infectious peritonitis. So
Oh, that's amazing.
I'm not sure if I can say this here, but if anybody wants to donate FIP fund that they have, I think it would be much appreciated because
Right?
they really do amazing job and support a lot of therapies.
Yeah. Yeah. I hope people do because especially like you said, this went from 100% mortality to 80% at least being saved. I think that's so amazing.
Yeah, and actually
Yeah.
one of the first studies with the GS antiviral have been funded by Every Cat Foundation as well. So
Wow.
I don't think we would have the treatment we have these days if it wasn't for them.
Yeah.
Yeah.
Do you have
And I
other
do not work for them.
yeah. Do you have other research that you're doing as well besides this?
Yes, absolutely. I definitely love focusing on other cat topics as well. So I'm actually now researching a new kind of newly discovered disease called, and now everybody keeps breaking their tongues when I'm saying this and they try to repeat it, but it's called feline gastrointestinal eosinophilic sclerosing fibroplasia. See, even I struggle
Whoa.
with
Yeah.
that. We definitely need to think about renaming it.
Yeah. Or at least shorten it to like, a couple letters or something.
Exactly,
Yeah.
exactly. But it is actually a disease that occurs a lot in younger or middle-aged cats and often in pedigree cats, actually, especially ragdolls. And it occurs as like a gastrointestinal mass, or it can affect the lymph nodes as well.
Mm.
And most of these cats are misdiagnosed as having cancer,
Yeah, I was gonna
but
say that sounds like lymphoma to me. That's what would have been my first
exactly.
guess.
But your prognosis with a large cell lymphoma is much worse
Mhm.
than with my
Right.
feline eosinophilic
Yeah.
sclerosing fibroplasia.
Probably, yeah.
And the problem is that a lot of these cats do really well. They can live for years with this
Hmm.
disease and usually die of some other disease when they get very old. But some of these actually have much shorter survival. So we are actually doing a study where we are collecting retrospectively. So from patients that have already been diagnosed, we are getting those histopathology kind of blocks
Mhm.
and trying to see if we can find differences between the cats with the same disease
Mhm.
and also look into possible infectious agents like parasites, bacteria, and so on,
Yeah.
that we could see as an underlying trigger.
Wow. Yeah, I didn't even know this was a thing. So that's pretty amazing that I've learned this today.
Yeah, it is quite underdiagnosed disease in cats,
Mhm.
but I've just published a paper on 60 cats with this disease, which
Wow.
I would say is a big paper. And I'm
Yeah.
very proud of that. It was a lot of work and a lot of searching and of cases and collaboration, because on this study I've been collaborating with colleagues from UK, colleagues from Australia, colleagues from Japan actually,
Wow.
and United States. So we have patients from all over the world, and this new study actually is a even bigger collaboration. So
Mhm.
I just try to be very passionate about what I do and bring so many people together to share samples, because this is definitely a less common disease. And if I
Yeah.
just, did this study on the cats I diagnosed, which is probably less than 10 to
Mhm.
this point, my study would be much smaller. And we probably are going to get about over 100 samples for this new study. So I'm
Wow,
very
that's amazing.
excited.
Yeah, that's even more than your FIP one. You said FIP was 80, right? 81
61, but
or
it's
61,
actually a
sorry.
prospective clinical trial.
Mhm.
This is like a retrospective
Oh,
study.
okay.
So when we are getting things that have already been done, it's so much easier than
Mhm.
actually doing everything from now to the future. Prospective studies are definitely a lot of hard work. So we
Yeah.
see those patients at the visit, what we call zero, so the initial visit, and then we recheck every one of them every 4 weeks, because we of course very closely monitor how they're responding to therapy. But this
Mhm.
is a new drug, so we are very, very closely also watching for any possible side effects from these medications as well,
Nice.
and monitoring their blood work, like white blood cells parameters, their liver enzymes, and everything. So it is a lot of work. Imagine we see
Mhm.
60 patients on a monthly basis.
Right.
So yeah,
Yeah.
definitely we've been busy.
And have you seen any side effects from it yet?
We have seen a couple initially when the patient started therapy. Some of
Mhm.
them develop hypersalivation or nausea.
Mhm.
So we've been treating that with some anti-nausea medications. We've had very, very few cats that developed increase in liver enzymes. Usually it's
Okay.
very mild and it seems to not cause any clinical signs at all. And it usually goes away when the patient stopped the therapy. So we didn't have to stop it in so far a single patient for
That's
severe
amazing.
side effects. So that's wonderful. Yeah.
Good. Fantastic. It seems like this study is going so well so far.
It
Yeah.
is. I'm like, I don't want to jinx it for
I know,
now.
right? I mean, I did a little bit of research in undergrad and mine didn't go nearly as well and mine was on flies. So, yeah.
Oh, but I've really been preparing for this study for three and
Yeah.
a half years. So
Yeah.
I would like to say that I did my very best so everything would
Right.
go well. But it's,
Nice.
of course, a clinical trial. So things might not always go great.
Mhm.
And we definitely lost some patients, even
Mm.
trying everything. So it
Yeah.
is still not 100%, but I hope I will not stop with my research until
Right.
we get to 100% survival.
Exactly. Exactly. And real quick, I forgot to ask, is this for dry and wet FIP or just wet FIP?
Mhm. So the part that has been funded by Every Cat Foundation is for effusive only, but we
Okay.
have opened it to other cats with dry form as
Mhm.
well. So about 30, a little bit over 30 cats are effusive, and the other 30 are dry neurological. And we
Wow.
actually have a lot of cats with ocular involvement,
Mhm.
surprisingly. I have never seen so many ocular FIP patients until
Yeah.
recently. But yeah, I would say probably at least 10 to 15 have ocular signs of the
Wow.
patient. So it's a lot of them.
Yeah, that is a lot of them. I think
Mhm.
I've only diagnosed one ever, so that is quite a lot. Yeah.
Yeah, I was very surprised. So I don't
Yeah.
know if we are seeing like a new strain of the virus or
Mhm.
something new that affects the eyes a little bit more, or if it's just a random thing, but we've
Right.
definitely have seen quite a lot.
That's amazing. Also, is there anything that people can do to be more involved in the research? You had mentioned about donating. Is there anything else?
Yeah, absolutely. I think donations are really, really wonderful, either directly to us, but also, like I mentioned, like Every Cat Foundation, they
Mhm.
have amazing scientific board, and people from all over the world can actually submit grants to them once or twice a year when they have this what we call for grants.
Yeah.
So scientists or veterinarians from all over the world can submit their proposals, and then these proposals go through a scientific review, and then they assign who gets money at the end. So I think this is one really, really great way. Other ways, I think, is also just for some research like this is a clinical trial. So if you actually do not have the patient that has the disease, you, of course, it's hard for you to
Right.
participate. There are a lot of clinical trials where people need also like healthy control animals. So for
Mhm.
example, when we are doing like research on patients with like cognitive dysfunction, sometimes we need like older patients who are healthy and do not show any clinical signs.
Mhm.
So, for example, then your dogs or your cats could be getting some free annual blood works, free exam, and all of these things. So I think clinical trials are definitely very helpful. Plus, on top of everything, you are definitely helping to advance medicine and helping to help other pets, of course.
Yeah.
And there are also a lot of places where they accept donations, and for example, in once the patient passes away, for research as well, for tissue collections and donations. So that's also very important. So I think there are a lot of ways people actually could get involved
Mhm.
in research, depending on what and how much they feel comfortable with or what they would like to do.
Yeah, and how can they look for these things or figure out how to get involved with them?
I would probably say best place would be, depending on the state they live in, would be to reaching out to the university, because private practices can do sometimes research, but they are of course quite limited. So
Mhm.
usually it's academic institutions like universities that are the main places for research. So I would probably advise them to reach out to the university
Okay.
in their state and see if they accept donations or if they are running currently some clinical trials they would
Mhm.
like to be part of as well.
Yeah, I think I easily was able to Google your trial, just looked up, I think it was like FIP trial Colorado, and was like easily found all the information on how
Yeah.
to apply for being in the trial.
Yeah, and that was
Yeah.
actually the great team at our CSU, because I don't think I would have been ever able to put it on the website
Right.
so people would find it. So we
Right.
are amazing team. You know, they're not scientists,
Uh,
but they do this really important
mm,
work as well, like making the website for the
yeah,
clinical trial and making sure when you Google FIP, this comes up, because
right.
I'm pretty sure if I did it, you probably would have never found about
Mhm.
this
Exactly. I always
trial.
say I'm really good at being a doctor, but I'm not very good at, making websites,
No,
so,
me
yeah.
neither.
Alright, do you have anything else that you wanted to share with our pet parents?
I don't know. I would probably like to just maybe tell them that when it comes to FIP, if their cat ever gets diagnosed, I
Mhm.
think these days with the clinical trials, but there are other options as well for treatments. I would definitely try treating these kitties, because I think we can really get about 80% success. So I would
Mhm.
just make sure they are aware that there are treatment options these days for their
Yeah.
cats, and they don't just decide to euthanize them, or because we really have amazing success rates with these new antiviral medications for
Mhm.
these kids. And a lot of the times also people ask me and they panic a lot when one of their cats gets FIP, for example. What do I do with the other cat? So most of the cases, FIP is actually not contagious between cat to cat, unlike the coronavirus, because we all know the enteric coronavirus, every cat has it. It's very contagious. It spreads very easily. And with this disease, the transmission from a cat to cat is rare. Saying that, I with cats, I have learned now at this point, and I'm not that old, to just know that never say never when it
Right?
comes to cats. So the
Exactly.
one time you say it never transmits like this, it will.
Yep.
We actually have a big FIP outbreak in an island called Cyprus,
I
which is
talked about this, yes, I was gonna ask you about it too.
yeah, which is in
Yeah.
Mediterranean, and I actually have been there a
Oh,
couple times.
nice.
It's one of the most beautiful islands in the world.
They call it, like, Cat Island, essentially, right?
Exactly,
Yeah.
they worship cats there, so it's
Yeah.
my perfect. So I'm gonna retire on.
I know, I was like, "You don't live there now? Why?"
No, I know. Once they get this outbreak under control, because now I don't want to move there with my cats. But
Good
once this
thinking.
gets under control, and I'm part of research group that is helping, because actually my ex boss and mentor, Professor Gunmore from University of Edinburgh, is one of the main leaders on the team. So I've been helping in the background a little bit when I can. So there is a big outbreak, and we actually think there is a new strain or new recombinant virus that potentially can cause transmission from a cat to a cat.
Yeah.
We are yet to discover this in the United States. I actually had two suspicions for my cat to get transmission during my clinical trial. So we actually had
Mm.
sequenced the virus and sent it to Cornell University for sequencing because we collaborate with them a lot on that. And it is not the same virus. So we are at the
Okay.
moment still safe in the United States.
Yeah.
But it seems to be that there might be cases outside of Cyprus, also in Europe. So I think we need to be very careful about this. And I'm
Yeah.
working very hard now setting up a new PCR, which is like a molecular diagnostics for this new strain of or the recombinant virus here at CSU. So I'm hoping we would be able to test for it by the end of the year.
Very nice. Yeah, because that would just I had talked about how that's just going to make the number skyrocket from that very minimal 5 to 10% to,
Yeah.
who knows?
I know it was thousands of cases
Yeah.
in a small island. So I
Yeah.
don't even want to imagine what impact it would have on a big country.
Exactly. Yeah. I was going to ask you what your favorite animal is. I'm assuming I'm assuming it's cats. Am I right?
Yeah, exactly. I have no dogs. I always have to tell people I do
Yeah.
not hate dogs. I like dogs. I am just such a crazy cat lady, and for me, it's cats. I at my age still single and just have those
Just
cats.
have all the cats. Yeah. My kids are crazy cat people as well. We have 3 dogs and they do not like any of them. They very much if we walk into a house with a cat, they're immediately just on top of the cat.
Oh, yeah.
Yeah.
No,
Yeah.
I've always loved cats so much. And yeah, I
Yeah.
think it's definitely hard finding a husband with the 6 kids in the house and me working all the time. But
Right. According to my wife, so we have the 3 dogs, 3 cats, chickens, a leopard gecko, and she figured out the secret was just to marry a veterinarian. She's
yeah.
a nurse.
Yeah,
Yeah.
see, I don't think that I tried that and then I end up always having arguments at home about my work.
Yeah, understandable, yeah.
Yeah.
Maybe somebody who doesn't deal with cats, like, maybe like a horse person or something.
Yeah, maybe. I'm not sure. I
Yeah.
tried that too, actually, and
Okay.
that didn't go very well. Yeah, no, just someone who very much loves cats,
Yeah.
and hopefully through that someday also me.
You also have another side business, is that right?
Yeah, I
Mhm.
actually I don't think I can call it a business
Yeah.
yet. I don't really make money with it yet. But
Same here, it's okay.
yeah, I actually started this about last year. It's a company called Crazy Cat Vets. So I
Uh-huh.
am just also very passionate about feline medicine education. So
Mhm.
I lecture a lot at conferences and for students. And I just would like to spread the knowledge I have
Right?
about cats and share it with other people
Mhm.
so we can improve feline medicine all over the world. Yes, so I started that. I'm looking into kind of focusing more on lectures, but also doing some potentially consultancy on complicated or difficult cat cases for other veterinarians as well in the future. And we actually organized our first cat breeder conference last year,
Oh,
and
wow.
it was a success. So I think we're gonna do one this year again. So it
Nice.
was a lot of work. So
That's in Colorado, is that where you did it?
it was actually online,
Oh,
and
okay.
we had breeders from United States, Europe, and all over kind of the world. So it was very
Wow.
exciting, and we had amazing speakers. It was 2 days all about cats, and yeah.
You
So
must have been in heaven. Yeah.
I was because I think education of breeders, but also cat owners, is very, very, very important
Yes.
because cats are very special creatures and you really need to get to know them
Mhm.
and understand their needs. Because if you imagine how they were in the past, just running wild, catching
Yeah.
mice all day, and now we expect them to be very happy indoor only
Mhm.
cats where they get dry food twice a day,
Right.
and it's not how cats were made. And so I think understanding cats as animals, where they came from, and just how hard sometimes it is for them to adapt to living inside our
Mhm.
homes, it's very, very important.
Yeah, absolutely. Yeah.
And then we deal with a lot of cats get relinquished or euthanized because they
Mhm.
pee outside of their litter boxes.
Right.
And the cats usually do that because they're not happy with something, and we need to understand what is it that they are not happy about to try to make them happier to live with us. Because I actually have 6 cats in my house, but I work very, very hard
Yeah.
so my cats can have a good life and
Right.
have a lot of space. We have patios because we live by a main street, and multiple litter boxes, and my walls are full of scratching posts
Nice.
and everything. I think it's really important to understand their nature and their behavior so we
Mhm.
can prevent a lot of diseases.
Yeah, and there's so many people who do dog training and just not a lot that do the cat behavioral things. So I think that's pretty amazing, especially to bring a whole bunch of people together to be able to talk about those things as
Yeah,
well.
and I think you cannot train cats. My cats have
Yes,
trained me. So
exactly.
definitely there is no way you will train a cat, but
Right.
it always comes with the respect. And I have to say, and I've been a vet student for 6 years and now vet for almost six. And I have to say, I've never ever been bitten by a cat.
Wow, that's amazing.
And I
Yeah.
know. And I have been, even before I was a vet student, I was actually a cat judge, and I'm a cat judge as well,
Nice.
international cat judge. So I'm like the ultimate level.
Yeah, you are.
Yeah. And I have to say, I've been bitten once by a cat on a cat show, and there
Wow.
was probably about, I would say, almost 20 years ago, very long time. I was very
Oh my
young back
gosh.
then,
Yeah.
and never ever since. And it's because I really respect the cats, and I
Mhm.
never make them do things they don't want to do. And even our clinical trials patients now, I've spent so much money, big part of the budget went for these different treats for the cats,
Oh,
and
nice.
and so they can really be comfortable when they come to see us.
Good, good.
Yeah.
That's amazing.
Yeah. And I think you should cut me off because I could be here until
I
tomorrow.
know, right?
Okay.
All right. Thank you, Dr. Cherna. I appreciate this so much, you coming on and just explaining all these things to us. This is just such a different world from my emergency world doing research and just all the work that you're doing to help save all these cats.
Thank you so much for having me. I hope you're not regretting
No, no,
having me
not
here
at all.
tonight. And
I'm so excited. I think we'll definitely have you on for more. I'm really excited to hear, especially about all your crazy cat vet stuff.
yeah, no, thank you so much for having me. This has been a pleasure, and I'm always happy to talk about cats. Thank
Awesome.
you.
Thank you, everybody. As always, make sure to keep your pet happy, healthy, and safe. Thanks, guys. I just wanted to give a special thanks to Dr. Cherna and her team for everything that they do for our cats. Also to Tori and Renee for allowing us to follow Moaning Myrtle through her journey, to Sean Heiberg for doing all the editing, and for Kelly Dwyer for doing podcast production. Thank you, guys. We'll see you next week.